All right. Hello everyone. So I'm Dr. Tushar Mehta and जो इंटरव्यू की सीरीज चल रही है इस बार जो एक बहुत ही अच्छा रिजल्ट हम लोगों ने अचीव किया है अपने डैम्स के पटना सेंटर के स्टूडेंट्स उन्होंने बहुत अच्छे अच्छे स्कोर सब लोगों ने अचीव किए हैं। तो उसी में एक कड़ी में मैं एक आपको और स्टूडेंट से मिलवाने जा रहा हूँ। इनका नाम है डॉक्टर पीयूष रतन एंड ये आईजीएमएस जो इंदिरा गांधी इंस्टीट्यूट ऑफ मेडिकल साइंसेज हैं उसके स्टूडेंट हैं 2015 बैच से एंड इन्होंने 614 स्कोर अचीव किया है नीट पीजी 2021 में। तो सबसे पहले डॉक्टर पीयूष हार्टिएस्ट कंग्रेचुलेशंस एंड वेलकम टू द इंटरव्यू एंड थैंक यू सो मच फॉर गिविंग टाइम।
Thank you, sir. It is my pleasure for this interview, and I would like to express my expressing my gratitude to the Almighty for conducting this exam after so many delays, and my entire family for being supportive, especially my mother, and sir, especially to you and entire dance family, sir. It has been a great feeling of being part of this family, and obviously, sir, the classes and the notes were like that was the base which it provided. So it is like a great feeling.
थैंक यू सो मच डॉक्टर पीयूष। पीयूष आपने कब ज्वाइन किया था डैम्स एंड हाउ वाज योर जर्नी विद अस, थोड़ा बताएंगे उसके बारे में?
Yes, sir. I joined dance in my pre-foundation year. In my second year, it was actually I was in my third semester, and my pre-foundation year, I was not very serious with the classes. Like I used to go to the classes, but I was not actually making notes in like a proper way. I was not very attentive in class. I have done like all the mistakes in my pre-foundation year. Like I have I have missed the class. I have made notes. I have slept in class. I did every mistake like aspirant should make in like I did everything in my pre-foundation year. But then, sir, the change happened when Dr. Siddharth sir's PSM class happened in April 2018, and it was the start of my third year also. And his class was like a very mind-blowing session, like not in just terms of notes and the material which he provided, but also in terms of motivation. He said like things like always keep your head high, even if you're in like a peripheral institute. You should always keep your head high and like study hard and aim big. Like don't just be like mendhak ka kua, I can say. Like aim big. So from there, it actually started. I actually started my preparation seriously. All the class after that, after his class, I was like totally in awe with the actual teaching, like the actual concepts which were being taught in the class. So I also started making notes like very sincerely that time using like multicolor pens and everything. And also I used to like revise my notes and study like in the later half of the week. I would also solve all the MCQs with along with the classes. And during third year also, we had like a free time. We have like a free time in third year. So at that time, I also like I was attending classes of the like the second and first year. So I also covered them as well. So in third year, actually, I didn't plan anything for the final year. I didn't even attend the classes of the final year. So when the final year started, so I attended all the final year classes along with some of the like microbiology and biochemistry. These were my weak subjects. So I attended biochemistry class 3 times, and like microbiology also I attended 3 or 4 times. In internship also I used the video classes which were there. So that and by that time I was like really serious and focused and I had it in mind that I have to crack it in my like first attempt, or I would not take like any drop, because in my UG days I took a drop here and it was really very tiring mentally and frustrating for me, the drop here. So I was like very I have to crack it in like the first attempt. So that was my first thing. Yes sir.
इतना मैंने तुम्हें सुना है पीयूष, मुझे ऐसा लगता है कि तुम काफी ड्रिवन हो, मतलब
यस सर,
काफी गोल ड्रिवन हो, काफी मोटिवेटेड हो। तो ये शुरू से था या ये एमबीबीएस के दौरान या ड्रॉप की वजह से हुआ? बताओ थोड़ा इसके बारे में।
So driven, so actually an incident happened. I was in my third year. It was like my third semester examination, internal assessment, and I failed in my pathology exam despite studying hard for it. Like I was like a very cool going, like I did all the stuff before like third year. In first year and the early part of sorry, in third semester, in the early part of third semester, I was like very कि college है, अभी नए नए आए हैं, तो let's enjoy the college life and that. But in my third semester internal assessment, I like failed in my pathology exam. So from there, after that, I was, and also, sir, I joined the DAMS class. So when I walked into the classroom for the first time in my third semester, so I looked at this crowd. There was this big crowd in front of me, and that really pushed me. Ki, like I have to stand, I have to compete with them. I have to stand somewhere. I don't want to just be an average doctor. I have to like be there, make a name out of myself. So that was like so this is what happened actually in my pre-foundation year, that even though I was not attending classes very sincerely, the atmosphere which the dance gave, like those like there were Sanjeev sir pathology classes, there were he used to ask questions, and I can see like many of the toppers or like the first venture, they are giving answers like in a second, or like they're just giving answers very nicely and neatly. So that then I thought that these are the topics which I've been taught in my classes in my college and my in dance also, and then also I'm not up to par with them. So that is when this actually driven part happened with me, that I have to be like be at a good level so that I can get through this. So from there it actually started.
आई थिंक वो जो क्लासरूम में जब तुमने लोगों को और लोगों को अपने साथ पढ़ते हुए देखा और जो बाकी
Yes, sir.
से थे, आई थिंक वो एक कहीं ना कहीं एक मोटिवेटिंग फैक्टर वो भी होता है, जो पिछले 1-1.5 साल में मैंने खुद ने भी ऑब्जर्व किया है कि एक कमरे में बंद होके
Yes,
या
sir.
एक लैपटॉप पे या आईपैड पे या उस पे करके, तो यू हैव टू गो आउट देयर टू सी द कंपटीशन, टू फाइंड द कंपटीशन, टू
Yes,
गेट
sir.
मोटिवेटेड एंड देन टू फाइट विद द रेस्ट ऑफ द पीपल हु आर गोइंग टू राइट द एग्जाम विद यू. नाइस. तो पीयूष, अब मेरे को एक बात बताओ कि आपको जब आपने क्लासेस अटेंड करी, आपने काफी अर्ली थर्ड सेमेस्टर में, जैसे आपने बताया, आपने क्लासेस ज्वाइन करी थी, तो उसके बाद जब आप आगे बढ़ने लगे तो कोई कुछ, आपने डॉक्टर सिद्धार्थ का नाम लिया, आपने डॉक्टर संजीव का नाम लिया, आपने और भी बताया, बट कहीं ना कहीं डिस्पाइट एवरीथिंग, ऐसा नहीं हो सकता किसी इंसान की जिंदगी में कि कोई पीरियड ऐसा ना आए कि हम हताश होने लगते हैं, हम निराश होने लगते हैं इंटर्नशिप में आके, फाइनल ईयर के एंड पे आके, फिर
Yes.
कोविड भी हो गया उस टाइम पे लोगों को. तो क्या चीज थी जो आपको जिसने मोटिवेटेड रखा? बिकॉज मैं जानता हूँ बहुत सारे आप ही के बैच के, मतलब 2015 बैच के, मैं बहुत सारे लोगों को जानता हूँ जो आई थिंक 2020 में आके दे समवेयर लॉस्ट द ट्रैक. कहीं ना कहीं उन्होंने ट्रैक लूज कर दिया, बिकॉज बहुत
Yes.
लोगों को लगा कि अब तो कोविड हो गया है. मतलब जिंदगी की सही बोलूं तो प्रायोरिटीज चेंज हो गई, बट आपने अपनी प्रायोरिटी अपनी पढ़ाई को ही रखा. तो और प्लस आई थिंक आपने उसके बाद शायद टीएनडी भी ज्वाइन किया था. तो आपने ये सारी प्लानिंग कैसे
Yes,
की?
sir.
क्या चल रहा था आपके दिमाग में? आपने अपने आप को कैसे उस दौरान मोटिवेटेड रखा?
So I used to watch a dance interview like on the Dance Daily channel. They have these interviews. So I like whenever I was feeling like lost or like something like if I'm also in like some GT score or anything in any part of my preparation, so I would just look at those interviews. Like I have like 2 or 3 like my favorite interviews which I have like seen like so many times, like 7-8 times during my like entire preparation phase. I've just watched and rewatched it like many times. So from them I used to like derive more of the inspirational thing that I have to just keep going. Like I have seen like people getting from very below rank to like a very great rank. So those kind of things, and like in every interview I've seen like some topper talking about one or problems of them, like how they overcame the like the stagnation in their GP score and everything. I just learned from them, or this was the like main part where which I referred when I was feeling down.
एंड आई थिंक यू चोज द राइट वे. सो यही होता है कि अगर आपको जिंदगी में आगे
Yes,
बढ़ना है तो आप कोशिश करते हैं उन लोगों की तरफ देखने की जो यहाँ पे हैं. सो
yes,
वो चीज कहीं ना कहीं आपको मोटिवेट करती है. पीयूष, पटना में जो बहुत सारे इस वक्त 2018, 19, 20 बैच के स्टूडेंट्स हैं, जो मतलब आपको शायद आइडिया भी होगा, बहुत सारे आईजीएमएस पे तो चलिए उतना नहीं है. कुछ कॉलेजेस के अंदर तो अभी एग्जाम्स भी डिले हो रहे हैं, और बिकॉज ऑफ द कोविड
yes,
एंड द सेकेंड वेव. there's a lot of chaos which is going on. कोई कह रहा है कि यूनिवर्सिटी अभी डिले हो गया है, सेकेंड ईयर के मेरे एग्जाम नहीं हुआ है, बट आई बीन प्रमोटेड टू थर्ड ईयर. सो आई एम इन अ फिक्स कि मैं सेकेंड ईयर पढ़ूँ कि मैं थर्ड ईयर पढ़ूँ कि मैं ना पढ़ूँ कि मैं क्या पढ़ूँ. तो क्या मैसेज देना चाहते हो पीयूष आप जूनियर्स को, लोगों को? आप कौन सी ऐसी चीज है जो आप उन्हें समझाना चाहते हैं, जो आपको भी लगता है कि शायद उस वक्त पे आपको पता लगी या आपको किसी ने समझाई, या अगर और भी समझाई होती तो आप और बेहतर कर पाते? तो व्हाट इज दैट वन piece of advice, being an elder, being a senior, you want to give?
So one piece of advice I would like to give is be thorough with your books, be thorough with your notes, whichever you have made, like whichever institute or whatever it is, be thorough with them. Like you have to study. Like this is medicine. Without studying, you won't sail through this. So you have to study. And one thing I would like to say is that to the seniors, that you teach your juniors. Actually, this is I didn't see it in my college, but that actually after teaching like some topic to your juniors, like if you are in third year, teach something to your second year. By that way, you can see the lacunae in your concepts also. So that is one thing I would like to say. And as far as the exams, like university exams are, like keep studying for them. No, don't like leave. But if you are getting like a free time due to COVID, it's not like it's actually a free time. Later half in your like college time, you will feel the crunch. You will feel that okay, the वहाँ जो समय मिला वो यहाँ पे बहुत कम मिल रहा है. तो so like be like in the flow. Like if you are getting some time, read some, like if third years are getting some time, read some clinical stuff from final year. Like read the systemic examination of the different system, like respiratory, abdomen. You can read many things. Like there is never a shortage on the stuff that you need to learn in medicine. So just keep this, that you have, even if you're not finding that interesting, you can go to your notes and like study, like prepare some of the subjects yeah, at right now for the NEET PG or next, whichever happens in your time. So this is what I would say to them.
ग्रेट, ग्रेट, थैंक यू सो मच. अब मुझे एक बात बताओ पीयूष, जो हमने बाकी क्लिनिकल ग्रैंड राउंड्स और डीवीटी और इंटीग्रेटेड सेशंस जो प्लान किए थे, इनसे भी आपको डीवीटी वगैरह से मदद मिली थी आपकी तैयारी में?
Yes, sir, final year or final phase of my preparation, that was the internship. So I would like to start from there. So during the internship, I almost had all the notes except one or two subjects were remaining, like the psychiatry and FMT, like two subjects were remaining, of which I couldn't attend the class in my final year. So I started studying from the notes and started giving the grant test. And I still remember before even starting my preparation in I started my preparation on 20th March. So the first day I just gave a GT on the dance platform, and it was a GT. So I scored like 150 out of 300 questions. So I was never looking at the actual number of marks which I got or the rank which I got. I was always focused on the like number of correct questions that I'm getting. So I attempted the GT. So I got 150 out of 300 correct questions. So it was in my mind that half the battle is like already won. I am like 150. I have a target of 300, 290, 280, whatever. But I was like, I'm like half the battle is won for me. So from there, and then I started my like studying the notes, and it was basically in the first 3 or 4 months, it was mostly just studying them and using the DQB and giving the grant test. And I can't emphasize like how important it is. Like this is just like a vital, like a vital sign, like giving grant test. Like I talked to my also talk to them, and most of them are like कि boss अभी देंगे फिर marks गंदे आएंगे ये वो. So I'm just saying you just give, like, this is like the best time to get in the habit of giving the grant test, because what will happen is, like, now if you're giving a grant test and even if you are scoring low, you know that you haven't studied, that's why you're scoring low. This will give you, like, okay, that when I will study, I will score like good number of questions I will get correct. So what happens is you give grant test so that you get in the habit of giving a grant test. Don't look at the scores, don't look at the ranks, anything. Just grant test, like, and see what you are making mistakes. The subjects which you have read, see thoroughly, go in depth, like where you are lacking in the concepts. But for the subjects which you have not yet studied, just take it easy. Don't like go in depth and do some research in that. This is like very important. Grant test and notes, like these two are the most important tool in your preparation. After that comes the TND. So I joined the TND in my internship here, and so it was basically to make, like, how many days to be given to a subject, like how to divide medicine and how many. So I attended all the TNDs, and so their explanation videos were really helpful. And so it was basically, our TND ended in I think around September, mid-August or September, I think our TND ended. And by that time also, like by the end of my TND, I also completed my notes, like the first reading of my notes. I completed by the end of my TND. And so after that, it was only most of my revision were through GPs and studying my notes. But once the DQB is complete, and I think you have given your TNDs, there is the main question practice remains through the grant test, I think, only. Also, sir, in October, I attended the DVT session, which was a really helpful, and it was a really a very nice way of revising the things. So that was a great session, sir.
Okay. Okay. आई थिंक आपने बहुत इंपॉर्टेंट पॉइंट्स टच किए हैं जो नॉर्मली हम एज अ फैकल्टी हम बताते रहते हैं कि ग्रैंड टेस्ट दीजिए, नोट्स के साथ TND टेस्ट दीजिए, अलाइन करिए चीज़ों को और नंबर करेक्ट क्वेश्चंस पे फोकस करिए। ये नहीं कि रैंक पीछे आया या कोई भी चीज़ गलत हुई है तो उससे कि नहीं मुझे अगला टेस्ट नहीं देना। आई थिंक पीयूष तकरीबन आपने हर जो चीज़ जो एक आइडियल सिनेरियो में सेटिंग होनी चाहिए थी आपने वो की, एंड प्रॉब्ली दैट इज व्हाई आपने इंटरव्यूज अपने कहा कि आपने कुछ इंटरव्यूज कई बार देखे हैं। आई एम श्योर ये इंटरव्यू भी कई लोग बहुत बार देखेंगे और आपसे सीखेंगे, एंड आई वांट दैट आपके जो कमिंग बैचेस हैं, जो जूनियर्स हैं, वो भी आपकी इन बातों को ध्यान से सुने और इस पे अमल करें। कोई एक मैसेज लास्ट में पीयूष आप देना चाहेंगे? आपको लगता है कि इस एंट्रेंस के जो ड्यूरेशन है उसके लिए कोई एक मैसेज आपको लगता है कि लोगों को वो चीज पता होनी चाहिए, वो चीज दिमाग में होनी चाहिए उनके?
सर, सेल्फ बिलीफ एक बहुत बड़ी चीज है. So, like, I had faith in myself despite so many delays. I also had I suffered from dengue in my, like, in September and October beginning. At that time, it was like the tentative date of the NEET PG was January. So I was like, I was literally like, okay, ab kya hoga? And then suddenly the date also got extended. Like the date shifted from January to April. So always have faith in yourself, always have faith in the Almighty that the things will work out. Also, so even in April, like when like the dates shifted from April to like this, there was a delay for like without any dates. So I, at that time also, I said faith ki, okay, let's take a break. At that time, COVID was at its peak. So I took a break and I joined this job at NTPC. So it was a COVID care. Here we have to see a COVID care unit. So I joined this job for 2 months. Like I worked like dedicated. I worked here only. I didn't do any study. And after that, I again when the cases were like declining, so I started studying again. And then also I had like a faith ki, like ek baar pura padha hua hai, I can do it. I have it in myself. Okay, so have faith in yourself. Like no matter how many days or whatever happens, there's always a way around. And like I had read this quote somewhere, like your faith can move mountains and your faith can create them too. So like always have that faith that you will move mountains, like you can do well. So this is like something which has always kept me going despite so many delays. So this is like my final message to my
बहुत अच्छी बात.
juniors, that always have faith, and like no matter where you are, in which situation you are, just keep going. Like the battle is not done till that 3.5 hours of the NEET PG has been, like that clock has struck that last minute, that last second. So let's just keep going.
बहुत बढ़िया, बहुत बढ़िया. Faith can move mountains and they can create them too. And बहुत बढ़िया पीयूष, आपने suggestions दी, आपने advice दी. And I just hope that not only आप एक अच्छे डॉक्टर बने, लेकिन आप एक अच्छे स्पीकर और एक अच्छे मोटिवेशनल स्पीकर बने और आप इंस्पायर करें. मतलब आई जस्ट वांट दिस टू हैपन. एंड आप अपने जूनियर्स को, आप चाहे आईजीएमएस या बाकी भी कॉलेजेस, जो भी लोग आपके संपर्क में आए, आप उन्हें जरूर सही राह दिखाएं, बिकॉज अल्टीमेटली दिस इज समथिंग दैट वी ऑल नीड एट दिस मोमेंट. बिकॉज पैटर्न भी बदल रहा है, नीट की बजाय नेक्स्ट आ रहा है, बट एट द एंड ऑफ द डे पढ़ाई सेम है, सब कुछ सेम है, एंड वी हैव टू go with that. Thank you so much. Thank you so much, Piyush. Thank you so much. It was really an awesome time
Thank you, sir.
chatting with you. Thank you so much. Thank you so much.
Thank you.